who have joined us today for yet another live, interesting webinar brought to you by Global Mantra and QurHealth. Today, we present a session on healthcare marketing, branding, and communications in a VUCA world. So, a panel of experts would be in two panels. First up, we'll be seeing a panel with for the medical value travel, the medical tourism industry. And next, we will be looking at how the domestic industry is putting things together and rising like a phoenix from the ashes from all this COVID crisis, and also the most important thing, the VUCA world. So before we go further, I would like to introduce our panel members. First, Mr. Joshua. He's currently the General Manager International Services with Yashoda Hospitals, Hyderabad. He's got 24 years of experience in healthcare industry. First half, he was in operations, and the second half, he has been doing a lot in international business and operations as well. So he was managing earlier with Global Health City, Chennai, and Fortis Mallar Hospitals, Chennai, before he had moved to Yashoda. And he's been with a few other organizations as well, like Friend Tenders Healthcare Private Limited, and also with the hospital in Kenya. Joshua was also working with Apollo Hospitals in the operations area. He had covered a lot of ground with countries like East Africa, West Africa, Botswana, Kurdistan, Bahrain, Sri Lanka, and Bangladesh in international business. He has completed his PG in science, followed by Masters in Business Administration. Pleasure to have you, Joshua. Any opening comments?
Actually, it's a great pleasure. Thank you, Raj, for bringing me in. It's good to be with this great panel. Wonderful people, the privileged people who are doing great things. And it's also a great pleasure meeting my great friends, Guru and Yogendra, who are two of the many pillars of medical tourism in India. It's a real great being here with everybody. And of course, medical value travel is actually one of the actually for India among the 41 destination. It's India luckily is on the top 5, and we handling it, working on it, and right now being attacked by the VUCA time with coronavirus. It's good opportunity for us to share with you all what's happening, how are we handling it, and things like that. Thank you, Raj, for giving this privilege. Nice meeting you all.
Thanks, Joshua. Next up, we have Mr. Guru Prasad, the Group Head of International Marketing with Narayana Health Group, Bangalore. He's a seasoned professional. He's been associated with the medical travel industry for the last 13 years and precisely about 8 years with the Narayana Group. He has earlier worked with Fortis Healthcare for about 5 years, and about 8 years prior to that, he was with various other industries like automobile, diagnostics, and surgical supply related industries. He's an academician par excellence, which is evident in the various degrees and diplomas that he has added to his name as a jewel over the years. He is looking forward to emerge India as an architect for the MVT industry in India, with like-minded people, aptly put by Joshua, one of the pillars, which will further the cause, bring many of the world leader association together and focus on events and L&D activities with respect to medical value travel, and above all, highlight India is ready to heal the world. Welcome, Mr. Guru. Your opening comments, please.
Thank you, Raj. First of all, thanks for organizing this webinar. You have collected an excellent team of people for discussion. I mean, from outside India also you have collected. I mean, thanks for that. And it's a mix of pharma and medical value travel, and we are going to see a wonderful discussion happening here. And it is great to be connected, and we all are sorry to be experiencing this pandemic. That's one of the worst things that we have ever seen in the mankind. But yes, we should be coming out from this very soon. Maybe in a couple of months, the international travel will start, and everything for us, at least for MVT, it is going to be a great reopening. I would say it's not an opening. So we are going to have a fresh start. It is not an old start. We are not going to continue the legacy, but rather it is going to be a fresh start in most of the countries. So let us see how we are going to move ahead. I'm sure that in further couple of other seminars or webinars you may be able to cover other things in the future, how we have come out of this pandemic. That will be a very interesting discussion. And thanks for once again organizing this webinar. Thank you so much. Welcome all. Thank you.
Thanks, Mr. Guru. Next up, we have Mr. Yogendra Rawat. He's the Vice President International Business for Sidecare Cancer Hospitals, Bengaluru. He's an experienced professional with strong domain knowledge with proven team management skills. He has worked as Vice President of the International Business at Healthcare Global. He was Head of Sales and Marketing at Pacifica International Hospitals, Papua New Guinea. He was a Chief Commercial Officer at Pathcare, Nigeria. He's been the Vice President of International Division earlier at Narayana Health Group. And he has interest in building the business and a very renowned name in the medical value travel industry. Over to you, Yogendra, for your opening comments. Yogendra, for your opening comments, are you muted?
Yeah, sorry, I got that. So thanks for the introduction, Raj. And I'm really happy to be here and really looking forward to hear views of my fellow colleagues here and looking forward for an interactive and a fruitful session. Thanks a lot.
Thanks, Yogendra. Next up, we have Ms. Shanti Shamdasani. She's the CEO of South Asian International Advocacy and Consultancy. She's also the founder of Shanaika Med Consult based out of Jakarta, Indonesia. She's a board member of the East Asia Business Council. She's a chairwoman of the Asian India Business Council. She's a vice chair of the Kedah Indonesian Chamber of Commerce Industry. She's the vice chair of International Trade, APINDO. She has 20 years of experience in policies, negotiations, government partnerships, project collaborations, NGO management, and other trade and investment-driven agenda. 15 years in Fortune 500 pharmaceutical, healthcare device, healthcare consumer goods industry, namely Pfizer, Johnson & Johnson, at a regional role with focus on managing many of the Southeast Asian countries like Thailand, Indonesia, and also some of the Indochina region and India as well. She is known for in-depth experience in Asian China, IACEPA, European CEPA, and RCEP, and other PTAs and international trade, including cross-border customs, e-commerce, market access, and technology-based industry. Her experience also covers working on a project base with the Office of the President of Indonesia, and she is actively leading various industry associations locally and regionally. It's a pleasure to have you, madam. Over to you for your opening comments.
Thank you, Mr. Raj, and good afternoon to all the participants and all the panelists. Just very briefly, and I will elaborate further in my presentation later on. But we are at a very unfortunate time. I think 2020 didn't start well for all of us, and the question now that is staring at our face is, what's next? So everybody's looking at each other and saying, okay, now what are these strategies, and what are the tactics, and is the market still the same as before? If it's a different market, then how would you kind of like adopt to this different market, which I think we will get into that explanation moving forward into this dialogue today. So thank you.
Thank you, madam. Next up, we have Dr. Bhupendra Yadav. He's the Director Clinical Sales at Intuitive Bengaluru, the robotic people, the Da Vinci systems. He's a student of business and medical doctor by training with about 15 years of healthcare experience, majorly in clinical practice and medtech commercial roles, mainly with the marketing and the sales team management. He's worked across multiple clinical therapies earlier, like cardiac, neuro, ortho, uro, gynecology, ENT, and extensive experience in launching and developing highly specialized therapies such as the deep brain stimulation and the robotic surgery. Currently, he's serving as a director of clinical sales with Intuitive, which is a pioneer of Da Vinci robotic surgery systems. He did his MBBS from SMS Medical College, Jaipur earlier, and also did his MBA from Vanderbilt University, USA. It's a pleasure to have you, sir. To you for your opening comments.
Yeah, thank you very much, Raj. It's a pleasure to be here, and I think that's my fellow panelists share. These are unprecedented time, and none of us have seen anything like that. So I'm looking forward to this is a perfect platform. We all represent different parts of the healthcare ecosystem, and we all are kind of learning, innovating, and solving problems to the best of our capabilities. So I'm looking forward to share what we are learning, also learn from my fellow panelists, and I'm sure the audience engagement also throws always interesting ideas. So thank you for having me here, and good afternoon, everyone.
Thank you, Dr. Bhupendra. Next up, we have Mr. Prabhat Kumar Sinha. He's the head of communications policy and patient advocacy at Novartis Oncology, Mumbai. He's a learning professional with over 19 years of progressive experience of managing large-scale program portfolio with corporate, international non-profits, and government sectors. He's presently associated with Novartis Oncology, innovation-driven global pharma group, and as part of leadership member leading the patient advocacy, policy, and communication portfolio for the India business unit. His expertise includes extensive experience in the domain of corporate social responsibility, patient assistance programs, market access, engagement with patient advocacy groups, industry associations and government, and corporate communication. It's a pleasure to have you, sir. Over to you for your opening comments.
Thanks, Mr. Raj, all the fellow panel members, and everyone who is part of this program virtually connected with us. When I saw the topic, the VUCA world, I think there are some words becomes very contextual at a particular period of time, and I think there cannot be a better time to discuss about these four letters. And there are a lot of challenges, there are a lot of uncertainty, but I personally feel that there are a lot of new learnings also have come up, and the key thing is going to be that how do we not miss out some of the good things that we have learned during this pandemic time. And I'm sure that is going to complement and supplement the initiatives that in healthcare ecosystem we have been doing. So looking forward for the interaction and discussion. Thank you.
Thanks, Mr. Prabhat. Next, we have Mr. Mohammad Ilyas, who's the founder and director for BCC Healthcare Branding and Marketing Chennai. He is an international branding and marketing strategist. You should attend some of his classes to know the kind of repertoire of knowledge that he can pass on to you. He's been successfully running BCC Healthcare Branding and Marketing Communication Agency, an integrated branding and marketing agency with a presence in India and as well as in the Middle East. He is well known for his in-depth knowledge and innovative thinking in digital marketing. He's a speaker, mentor, author of Ethical Hospital Branding and Marketing, and he's a digital marketing trainer. Welcome, Mr. Mohammad Ilyas.
Hi, Raj. Thank you very much for adding me here. Yeah. Thank you for that. Thank you very much, Raj, for that. And very interesting panel we have today. The show must go on. So we have a lot of interesting learnings from the panel. I believe we will definitely have a very interactive session. Looking forward for that. Yeah.
Thanks, Mr. Ilyas. Next, we have Mr. Vinayak Chakravarti. He's the Chief Operating Officer of HCG Bengaluru. He's got over 22 years of global and multi-regional direct and channel sales, product management, marketing operations, business management, result-oriented in intensively competitive environments like telecom, IT, healthcare, IT, and software service industry before he had taken over this position with HCG. He has been recognized for possessing skills that range from being a visionary to analytical thinker, a strong operational leader with track record for building high performance teams. He's got good knowledge of technologies and process such as AI, machine learning, process change management systems, governance, risk and compliance, and data analytics. The success in client relationship building and management positions has helped him to make a significant impact on organizations that he has worked for. So, Vinayak, it's a pleasure to have you here. Over to you for your opening comments.
Thank you, Raj. I think it's an honor to be a part of this panel. A lot of learning, earning in the last few months. So I'm looking forward to learn from the expert panelists here and of course share the experience that we have been going through over the past 3 months. So I'm looking forward to this panel discussion. Thank you so much.
Thanks, Vinayak. And so this is yours truly. Without any further ado, I will just move on to what we do as a company. So QurHealth India is a division of Global Mantra Innovations. Global Mantra Innovations, again, is the Research and Innovation Center for Ventec Solution Incorporated, USA. So Ventec Solution is one of the largest contractor for the federal health and the defense health related data and infra support in the US. We are a 150 million US dollar company in the US. We manage about 800,000 providers in the US, close around 800 dialysis centers with about 43 petabytes of healthcare data lying at our own data center. We are all aware that the Indian government, tomorrow we're going to have the big announcement of the National Digital Health Mission. In India, we always know how the public and the private need to work in coexistence. We do have the government hospitals, we do have the private hospitals. Like that, we are going to have a patient health record management system at the government level. We are trying to integrate a lot of private hospitals to replicate the system and have a health information exchange at the private level also. We have a strong leadership and a 700 plus team member between US and India, 600 in US and about 100 here in India. We have a variety of different roles which are related to biostatistic, data analytics, NLP, deep neural network, AI and ML. And the products that which we are developing are scalable and multi-layer. With the architecture is such that it's going to be very easy. It's like adding widgets to your phone and stuff. So QurHealth basically has two of its product line, which is currently available in the market. GoFHB is for the hospitals and MyFHB is for the patients. MyFHB is an application through which you can store all your patient health records. We have a lot of device integrations done, so it can automatically capture data from your blood pressure apparatus, your thermometer, your weighing scale, your pulse oximeter, and a few other things. We have Google integration. We also have a voice-based AI who's a personalized health assistant, Sheila. And so all this is fine, but patients are going to need their health records coming and flowing in from the hospitals. So that's where the GoFHB is coming. GoFHB is a web application. We have a proprietary scanning application which we give along, so wherein hospitals can digitalize their health records, and the records are pushed to the patients as well. The records are accessed by the doctors at the OPD. They don't have to wait for the medical record file to arrive at the OPDs. And also this helps the nation as a lot, because it helps in a lot of research and lot of other clinical developments over a period of time, a long-term project. So that is what we do. We are also happy to announce that we are on the anvil of launching our telehealth product. So that is something coming up in the next month. So we'll be hearing more about that in the coming presentations. So without any further ado, I would like to start the panel one. Panel two members, you could be on mute, and if there is an urge to answer, you could unmute and join in the conversation as well. So this presentation is going to be different. This webinar is going to be different because we are going to do it as a very interactive webinar with our panelists, and at the end we will be taking the question and answer session as well. So first up, we are going to talk about what is VUCA. You know, many people once when they were registering for this webinar, one of the thing which they asked me also, other than Dr. Google, so they also asked me what is VUCA. So we did clarify to them. It's volatility, uncertainty, complexity, and ambiguity related with the businesses. It was coined post the Cold War scenario around about 1987. It's almost 23 years from the word VUCA was coined. So we've had the great Indian liberalization happening in the early 90s, late 80s and early 90s. And then we have gone through all this in between, and now we are with this pandemic from March 15th, which it has been announced by the World Health Organization. So how do we counter this VUCA? What has happened to various businesses? What was the scenario before? What is the scenario now? And what is the scenario that which is going to, what is the outlook for the future? Is all that we're going to discuss with respect to the medical value travel. So we are here. So from here, where and how is the discussion going to be? We have interesting strategies to counter VUCA. So the volatility can be countered by vision. As I said, Vision 2020. How many of us know this statement? Every company had Vision 2020. Every interview that we all went, how do you see yourself in 5 years from now? What is your Vision 2020? So those were the kind of questions. We didn't know that 2020 was the year wherein we all need to really formulate our vision to overcome volatility. So Vision 2020, as rightly said all these years, this is the year we need to formulate our visions rightly. Similarly, the uncertainty can be overcome by understanding, the complexity with a lot of clarity, and the ambiguity with the agility. So here we have a panel which is going to tell you how they have gone through this VUCA cycle, how they have countered this, and how they are taking each day and winning each day. It is going to be one small step at a time while recovering from something like this. And I appreciate all of you being present over here. So here is my open question to the panel, especially to our heads of all the medical value travel. What has been the client traction to India and the travel patterns come into countries before COVID-19?
Can I start?
Yeah, go ahead, Guru.
Yeah. See, client traction and travel patterns, if you look at before COVID, it was very interesting. The volumes were very big because the markets were open. To be more specific, a lot of patients fearlessly used to travel from Middle East, Africa, from neighboring countries, from everywhere, because there has not been a single case of suspect for any kind of such kind of pandemics. If you look at the client traction, it used to be at least minimum of 10,000 patients per month used to travel inside India for medical tourism, at least. So this excludes the wellness, because wellness is a separate segment. When you look at alternative medicines, at least for allopathic medicines, there used to be at least 9,000 to 10,000, depending on the requirement. It used to change a little bit. But a lot of patients used to come from Africa for various specialities. When you look at the major specialities, major countries, we would say that major countries contributing to the medical value travel was from Africa, mainly Eastern African countries, including Kenya, Tanzania, Ethiopia was a major contributor, Nigeria was a major contributor. When you look at Middle East, the first country we would say is that Iraq. Iraq has been a great contributor for almost all the hospitals in India, including the southern part of India, including the northern part of India, the western and the eastern. Of course, eastern used to attract a lot of patients from the other countries like Myanmar, Philippines. We'll have few patients from Bangladesh. That used to be segmented like that. North used to attract a lot of patients from Middle East. South used to attract a lot of patients from Africa, mainly East Africa, and the eastern part used to attract a lot of patients from the neighboring countries. That's how it used to be segmented. The specialities used to be majorly cardiac, neurosciences. Cancer used to be the biggest contributor for the medical value travel. So likewise, see, one scenario I would leave open for discussion, very important thing is that We did not explore the option of online consultations and all those telemedicine and teleradiology. I think you have got one more question on that. We will come to that in elaboration when we discuss on that. But those were not given priority during that pre-COVID scenario. So telemedicine used to be there, but yes, there were operators. A few people used to have WhatsApp consultations and not a formal mode of communicating with the hospitals. Today, you look at post-COVID, of course, we are in the beginning of the session. The pre-COVID scenario never had the importance of telemedicine. You know, today when you look at second opinion, teleradiology, telemedicine, video consultation, softwares, and a lot of hospital information system softwares have newly started up because of all this post-COVID has taught us. Today, when you look at any of the hospitals, major hospitals in India, they already have, in fact, when I talk on behalf of Narayana Health, we already have an online consultation in place. Most of the hospitals have that in case. So thereby, this has taught us a lot of things for us. That's how it is. Again, when you look at the traction on the number of patients, it used to be phenomenal. When hospital specific, we alone used to get around more than 1,000 patients a month on an average from various international markets, including Bangladesh, Africa, Middle East. That's the attraction. The countries we have already discussed, the specialties are mainly cardiac, neurosciences, and cancer would be the top 3 specialties. Of course, the other specialties are gynae, about neurology and all those things. So that's the brief about the client traction and travel patterns. And in fact, when you look at travel patterns, most of us would have experienced there has not been any kind of safety measures or any kind of masks or hand washing. We did not experience anything. Today, yes, we have a lot of measures. If you look at the IATA website, a lot of precautionary measures we need to take before landing into India or any other destination for medical tourism. So that's the brief about the traction of medical tourism. Thank you.
Okay, so I guess it's my turn now. So I guess most of it Guru has already covered, and 100% I agree with him. Yes, to add to what Guru has already mentioned, medical travel, in India we have a different markets like Delhi, Bombay, Bangalore, Chennai. So these are the major hubs where patients are traveling. And although the reason for traveling to India is same, basically healthcare, but yes, the pattern changes from market to market. Delhi, there are different set people come for various other reasons. Bangalore, it's not like Delhi or Chennai, where in Bangalore hospital they have to fight for patients to come to Bangalore. They have to chase patients and they have to ensure that patient come. Unlike Delhi and Mumbai or Chennai, that is one thing which I wanted to add. And yes, definitely before COVID, things were very rosy. Things were very good in terms of for medical tourists, for medical value travels. We all were having good time. There were hospitals were full of patients, full of business. I wouldn't call it patients, but yes, full with business. And people were finding it very difficult to retain their good talents. And all of a sudden, things took a dramatic change, which we never had anticipated. I remember me and Joshua were in Kenya just before this thing happened, and it took every one of us by surprise. And today we are at a situation where we are actually realigning everything. Now, yes, but I also am by nature I'm a very optimistic also, and I believe this whatever we are going through has taught us so many things. For example, the inclusion of technology. What Guru was just mentioning about teleconsultations and video consultations. Yes, in past also we tried. I mean, in my previous organization also we tried, invested money, but it never took off. Even the government of India did their bit, but it never took off. But yes, now people have started understanding the importance and the value of teleconsultations, video consultation, or basically technology in healthcare. So that is one good thing which I see that this pandemic has taught us. Third thing is, as I said, I'm a very optimistic fellow, and I believe things will definitely take a turn, and there'll be a lot of realignment which will be done. Yes, we should be prepared for a slow growth. We will not be able to reach to the same level where we were before. It will take us some time, even though government of India opens their airport, or embassy starts issuing the visas, but it will still take time, because we should not ignore the fact that the patients also are thinking where they are going, because India is already now in top 3 countries where the pandemic has really has had a worse effect. So even for them also to travel to India, even though the flights are open, visas are freely given, still they will think twice to come to India. So that will also contribute to the slow growth. But yes, I think within a year or 8 or 9 months, or probably a year, everything will come back to normal. Till the time, we as an organization, I guess, as an industry, we need to sit tight and do whatever we can do to float, and try to be innovative in our approach. Digital, yes, there are a lot of things that we can do on digital space, but yes, currently, there are a lot of organizations, they are still debating whether this is the right time to go digital, to invest money in digital marketing or other marketing, because patients cannot travel. So there's no point of putting money in digital or other marketing activities. So probably in going forward, there are a lot of hospitals which have been very aggressive in marketing activities in overseas markets, in terms of organizing camps, organizing CMEs. We also have to take into account that going forward, probably the doctors may not travel easily. They may be willing to travel, but the organization may not be willing to take risk on doctors' life. So all these things we'll have to take into account, and as an industry, probably we need to realign ourselves what growth we are looking at. The growth which we were witnessing earlier, is it fair enough, or we need to realign that? We also need to discuss and consciously take a decision that things will improve. Definitely will go back to normal, but it will take some time.
Yeah,
Over and out
thanks,
for the
Yogen.
time being.
You're addressing a lot of questions which are also upcoming, but it's a good perspective that you gave us. And to put Hyderabad on that map of cities which is attracting a lot of medical tourists, Joshua, Yogen missed out on that. So you could add on how Hyderabad is also one of the key places, and
Yes,
then what is with the travel patterns.
yeah,
You ask me?
Joshua.
right. Is talk about. You're saying something, Yogi? Yeah. As what Bodhi was saying, yes, it's true. Things were all we were all really actually. Generally we were all prepared with the, like, for example, you're covering Muslim countries. Muslim countries, we know when they will not come. Ramadan time, Bakrid and time like that. You know when you can, which countries, which months, when you can expect patients, and you can all be well prepared with it. And and some countries for Christmas time and the academic opening time, you will not have patient, but the other countries you will have. So we are all well planned with things. And Hyderabad actually basically being with which a lot of Muslim communities here, and the food and things like culture is so much, and we have a lot of people from Sudan, from Somalia, all for being here for their education and things like that. So, and from these countries, we generally have always we are flooded with patients there, with here. And actually, even when the lockdown started, we had around more than 200 patients just from Somalia with us. And we had to just plan how to go ahead and manage all of them and things like that. So yes, and another one thing about MBT is that people somehow in many countries have still not, though they are facing the COVID and things like that, they've still not given up on the hope that they need to come to India for their surgery or for the treatment and things like that. And many of them even have a confidence that yes, India can manage healthcare. So when it comes to health, so they will manage COVID. So when we come, what should we do? That kind of people are there. Other kind of people are there also afraid. What all will you do? They're asking us also. But situation is, I mean, it's a kind of the balance is we're just trying to balance and figure out how to go ahead. But one thing is, as both of us them are saying, yes, it will take time. First for us to be sure how to handle it, and then for them to make them confident and make them come over here. And even they were actually all with the growth in MBT, all the hospitals were also, especially in Yashoda, we were associated with many hospitals and many countries where we were even doing surgeries and treatments out there also, and assisting and training the doctors there. And we were doing even liver transplant in Myanmar, and we are planning for some projects for just being assisting and helping out some countries in their upgrading their healthcare. But now everything has come to a still, and we right now, luckily, we have this Zoom and all these things with digital communication, with which our communication is on to make sure that we don't give up on things. But we'll all have to wait, and we'll have to see how things are going on.
Yeah, thanks, Joshua. With respect to the Southeast Asia, what has been the trend, Shanti, with respect to the patient traveling? I know from Indonesia, patient travel out, so you can give us a perspective on that.
Yeah, thank you for that. I was actually about to interject. I think Mr. Joshua did say interesting thing there. But what has actually happened? Before COVID, there were around 7 million patients from Indonesia that travel out every year for healthcare solutions. And the countries they go to are Singapore, Malaysia, and Thailand, right? So initially it was only Singapore, but then Malaysia and Thailand has come up in the last 3-4 years, and so the patient has split into Malaysia and Thailand as well. Just commenting on the after COVID and at the current time. So, and then I'll probably later on do a small presentation on Shanaika Med Consult. As you rightly said, one of the panelists just mentioned that online consultation was not the big thing before COVID. But after COVID, the kind of inquiries that we received from our side has actually increased up to 400 or 500%. So before COVID, what we were doing was we were actually helping patients try to identify the right doctors to reach out to. So it was more personal, one-on-one. For example, we were working with one cancer patient who had a complication of diabetes and who had a complications of other areas. So and she has gone to Singapore, and then she was not very satisfied. She went to Malaysia, and then she wanted to really have 2-3 other doctor specialists on board on her case specifically. So we were helping her with doctors from India, and we were helping her with doctors from the US, and also doctors from Germany. So, we were kind of like just doing this on an ad hoc basis, and then of course she would pay us a fee for doing that. But what has happened post, at this time is that we receive a lot of inquiries from patients who says, look, we are afraid to go to hospital. That's number one. Number two is that, we still need to consult the doctor because the kind of condition I'm having is I can't just take Panadol or paracetamol and sleep on it. I have to talk to a doctor. So then we started what we call, and then there is this regulation in Indonesia that you are not supposed to do, foreign doctors are not supposed to practice. So what we did was, and we trademarked this idea, we patented this idea, was we have a second opinion idea, but there's other elements inside of it which nobody can prove that we are trying to send patient outside of Indonesia. So, and why we are doing this is because we receive calls from doctors from India as well, who is also running private clinics and who's also practicing in a hospital, but then businesses have totally dropped as well. So we receive these inquiries from doctors to see if we can assist them to find patients. And the way it is conducted, and this is where it is patented, is that the way this is conducted is that it is non-prescription. The doctor will, at the end of the day, provide a summary for the patient, and the doctor will encourage the patient to go and see their doctors in their hometown, their original hometown. So all in all, what we are currently seeing is that even post-COVID, okay, let's talk about 2021 or even 2022. Everybody think post-COVID things is going to go back to normal, hunky-dory, and all is going to be nice. But then I suspect it will not be so. I think people have gotten used to technology to such an extent that this kind of meetings and this kind of arrangements will continue to take place. If COVID wasn't there, we would have spent, at least I would have spent my air ticket and my hotel ticket to be able to participate in this panel of discussion, for example. Before COVID, I was traveling like crazy for the last, 10 years, and I wouldn't spend more than 4 days in one country. And people used to look at my Facebook and they used to just comment like, you are never in one place. So that was what life was, before COVID. And after COVID, I think 40% of how we do business and 40% of how patient sees doctors and how doctors sees patient, there will be a change in that as well. So there goes my 2 cents. And then just one last point, countries like Laos, Myanmar, Cambodia, within Southeast Asia, for example, are heavily looking into online consultation, because for them to travel out is not possible, but they want to have, and they have they want to have access to a good quality healthcare services. So, yeah.
Yeah, the only thing I would like to add here is, if you allow me to speak, Raj, the only thing I would like to add here is, from the hospital perspective, yes, these consultations and everything, all these things are very crucial, very important. But yes, for hospital, the inpatients are important. So yes, the consultations, probably physical consultation to the hospital may drop, but for us, for a hospital, the importance of patients will never diminish. It will still remain as high as possible. And the only thing is, yes, we'll have more and more video consultations or teleconsultations, so that there are larger pool of patients where hospitals can try to convince them to come for a treatment.
Yeah, thank you again for that point. We need to move quickly because there are a lot of questions and we have another panel as well. So I request the panel 1 members to see how we can go quickly. There's been a percentage drop in business. It's a very big figure. So what is exactly the percentage drop in across the industry? And what is how is the management of various organizations reacting to this kind of a business drop? And how is the team, whether they are still working with the organization, or there has been reduction of team size or reallocation? What is exactly happening on that side of things when it comes to medical value travel and this pandemic that which we are in?
Interesting question.
Who would like to go first?
Okay, so I'm not sure. Let me. I think it's a very interesting question, and And I guess everybody here knows what is a percentage drop in business through MVT, especially international business. If I'm to talk about, because flights are not there, visas are not issued, so practically it's a standstill. So only business that currently hospitals are getting are those patients who are already under treatment. And for other specialties, it's even tougher. For organization like mine, which is a cancer hospital, where the treatment is prolonged, so where we still continue to see some kind of a revenue coming a month on month, but other hospitals are finding it very difficult. So, and effect on management and team, yes, we all know what is happening around in the industry. There have been salary cuts, there have been team reduction in the team sizes, all kinds of steps are being taken by different organizations. But this is where I believe that the strength of the organization management or the thought of the management is tested. I'll take example of my own organization, which is a small organization. It's a new organization. We just started 3 years old in the industry, and internationally also we were very at a very nascent stage, where we actually, when I joined in, we actually started building international business. From there, even though it's being a smaller organization, but management has stood by the team and by the department. And fortunately, there have been no pay cuts or salary cuts or team reduction. So that speaks volumes about, because it all depends upon the management. If they have that kind of a confidence and faith in their team or the business, they will stand by the team and see that things move on. Things normalize soon. But there are instances where bigger organization, they have failed to understand this, and they have taken steps which, in my opinion, are too drastic, which could have been avoided. This is my opinion on it.
Yeah, Guru, you want to add something?
Yeah, something. See, when you look at the overall percentage of the drop, actually, it is almost 90 to 95% of the revenue drop has been there for almost all the hospitals. Raj, can you hear me?
Yeah. Go ahead.
Okay. So when you look at the effects of management, Rawat exactly explained that some of the organizations have taken a hit on the on the revenue. Because of that, they have taken some drastic measures. Yes, there has been something, but overall, when you see the effects on management due to this COVID, the cost cutting has been there. The information center payments that we do has drastically come down. We have also been taken some measures on the cost cutting side for the overseas offices that we are running. The manpower cutting, what we have done in the overseas market, and also we have taken a call. But on the positive side of the COVID, the management has realized the use of technology. When I say use of technology, previously in my previous question also I've answered that at least that the technology is there, what has already been invented by all the people. It is not the time that we are inventing the technology right now. At least the telemedicine or the second consultation has been there earlier, which we are using it right now. When you look at telemedicine, it is some 10 years old technology. You have just started using it. That is one of the effects that management has realized, that the technology usage has to be more and more. And inside the hospital, when you look at overall, the hygiene factor, the civic sense has improved, because thanks to the concept of social distancing. So that has given an impact on the patients, the attendants, the visitors. They all have streamlined the process of the civic sense. And again, on the positive side, these are the factors. When you look at the team, yes, the team is really not motivated as before. Last 4 to 5 months, we as international travelers used to be traveling at least twice in a month or thrice in a month. But today, last 4 or 5 months, we have not been traveling. The team is here with all the hospitals. It is readily available, ready to travel once after they open up. Of course, I would want one more point, very important, is that we are in the mid of COVID. We have not reached the fag end or the end of COVID, right? So thereby, we are still living in the scenario, and this is the right question that you have asked, that what is the effect on team? Team is really not motivated. It is almost waiting for opening up of the international travel. That's it. Thank you.
Right.
Yeah,
Can I add?
Joshua, anything? Yeah,
Yeah,
please,
one thing
briefly.
is this question you asked, like the drop. Yes, of course, everybody's very clear. There is a huge drop, of course. But one thing is the way that management handles is, of course, one thing that I'd like to talk about. One thing I really I'm proud of the way the Yashoda they handle. First is communication to the. As soon as this thing started happening, all the staff were communicated over mails and said please and requested to wait and see what we will let you know what's happening. And then as soon as things are a little settled and things are falling in place, a visual meeting, all of us, and explain the situation, how we are doing, how we are going to go ahead. Everything was made clear to the staff. So staff actually was. Another thing is because there are plenty of patients out here who are stuck up here. We don't know what to do, how to go ahead. So that really gave us a real plan how to go ahead. We teamed up immediately and we started just working on the patients, what to do and things like that, and settling for them. And then afterwards, when the lockdown was settled and all, personally called everybody, encouraged everybody, and told everybody not to say, let's all wait patiently. Please don't be discouraged. And things will get back. The management encouraged the whole team and requested us to assist them wherever help was required. For example, right now, during this COVID time, there are many staff, the head in charges and things like that, who fell sick and with COVID-19 and things like that. So we people were all ready to be there and help them, assist them wherever there was a space, wherever help was required. So that way we were all involved. And when the person came back, we came back to and got together. That's how all of us are together. And that was really encouraging for our team out here.
Yeah, thanks, Joshua. It is very good to note how when organizations take time out, take a step back and relook at their vision, understand the market scenario and provide clarity across to the people, and also imbibe technology tools, making them agile, how they can overcome. So if you actually see, VUCA World is very easy if you actually know how to tackle. Yeah, Vishanti, you would like to add, or shall I move ahead? Okay, I'll move ahead since we have other questions all as well. Okay,
Yeah, go ahead.
the big thing is the government outlook and the measures that has been taken, and those which also needs to be taken. I would ask Shanti, why don't you give a perspective from the Indonesian side of things, where you have, for all the people who are here who don't know, Indonesia is the 4th largest populated country in the world. I had a brief opportunity of working over there for a year. So it's a 15th largest country. So we are talking with India and Indonesia perspective, which put together is really a massive population. Yeah, Ms. Shanti, can you just start with what was the government outlook and measures that were taken, and what you would advocate to the government further in Indonesia or in the Southeast Asian regions, and then I'll have the Indian team members, Indian international team members reply as well. Yeah.
Sure, thank you. So I think our government measures is no different from other countries. Everybody, once this COVID thing happened, everybody embarked in a social distancing. The whole building was disinfected, and there was measures that was taking, like wearing masks, washing hands. All these cautionary steps was taken, and 2 months down the road, the government realized that this is not a temporary thing as the number continued to increase, and so is the same with other countries. In the Philippines, for example, they did a total lockdown because I'm not just managing Indonesia, I'm also managing the whole of Southeast Asia, right? And we have offices in all of these countries. So the Philippines has taken a drastic stand in terms of they went for a total lockdown for 2 weeks, and then they went for a gradual reopening, and that's the reason why today the case in Philippines is not as dire as it is in other countries. Indonesia, for example, went to a partial lockdown or not a total lockdown. And even during the partial lockdown, people was allowed to go out of the house just to shop for their necessities, right? But not going to the office, or there was no business. So as a result of that, and there is always a curve, right? You take medical precautions, and then economy goes down, and then when you open up, then the COVID cases goes up. I mean, now after going into the 5th month now, governments have begun to realize, and I'm particularly talking about Indonesia, Malaysia, Thailand, not so much Philippines, and Singapore. Now they have realized on the dire or deep impact of economic stress on the on their growth. And for example, Indonesia is minus 5.3, Singapore is minus 10, and other countries is minus 7, 8. So there's a range between all of that. The only country that is growing as we speak today is China, because a lot of this PPEs are being produced in China and being sold in other countries, and we'll get into that maybe later. But the virus started from China, and now China is benefiting. And look at the beauty of this, right? But that requires a different thing, a different session. But just to answer to your question, we in Southeast Asia and also in Indonesia, we embark on the same measures like every other country does. And there's not much difference in what we do, and I don't want to repeat the same. All of us know, we have gone through several meetings where we repeatedly heard what is being conducted in terms of social distancing and whatnot. But one thing I would like to add here is that the stimulus packages, and I think this is interesting, right? Trillions of dollars have been pumped into the economy. The same thing is with India. Question today is are the stimulus packages that all these governments are issuing enough, or do we need to print money? And I know India have that question as well. And this is the question from in every part of the world. I mean, of course, if you print money, I was in a Zoom meeting yesterday, Mr. Raj, when there was a mock trial, and I was in a panel with 4 ministers, and that's the reason why I can't attend the mock trial. But in that meeting yesterday, there was actually, I was pushing to print money. And I was okay to drive the country into inflation, because at least we know how to manage inflation. It has happened before. Inflation is not an alien thing to us. We know what to do. But if we don't take any out of the box measures, then COVID is going to drag our economy further down. Then we don't know what to do, because we have never experienced things like this, unless any one of us is born in 18 something during the flu pandemic, which I don't think so. Anyone here is that old, right? So then, what action needs to be taken? I think we need to take 2 steps. One is the economic action, and the other one is health action. In terms of healthcare, still try to persuade people to do online consultation, at least for the next 3-4 years' time. Why? Because this will minimize the traffic of patient going in and out of the hospital. And like rightly said earlier, inpatient is impossible. I mean, if you need a surgery, you need a surgery. You have to go to the hospital. You have to stay in the hospital. But those who's running flu, running nose, and all these minor ailments, where they used to just run to the specialist and wait for 3-4 hours for the specialist doctor to see them, now they can do an online. So I think it needs to be twofold, and this is where the healthcare industry needs to revolutionize itself. They need to understand that they can't operate as before. And some of the, I have a few healthcare clients, some hospitals who are currently our clients, and I advised them. Initially, they got upset with me, and I said, you pay me big bucks to advise you. It's okay, you can get upset about it, but this is the truth. You need to divide your strategy, offline and online strategy. And there is no way going around with this. This is how the world will be. The world will be a divide between online and offline, and you have to adapt to that. So,
Yeah, thank you, madam. Thanks. From
Raj,
the India perspective, let us have one person answer this because we have other questions and we have 15 minutes to finish this panel. One of you
Raj,
could go for it.
Raj, can I add something real quick? That's an extension because I think Shanti made an interesting point with permission from panelists.
Please, please.
I think the point was the world post-COVID will look different than it was pre-COVID. And either we are part of aligning ourselves with the change or not. And one thing that I've been thoroughly studying, the user behaviors, the major shifts happen with three things. Number one, there need to be a strong driver. Then there need to be a technology platform. And the third thing, there needs to be supportive policy. And if you think what happened with demonetization, the digital payments, Paytm was there for a long time, but there was a strong need to adopt and change behavior. Then government introduced UPI and made it easy for all the companies to participate in digital ecosystem. And we have seen what's the change that has happened. Now, if you think about the corona, in a way, it's a version 2 of that the digital consultation was always there. So the technology is a decent technology is already there. But consumers and the providers never felt the need. COVID could be that trigger, potentially. Second part is, now the technology is still basic, but the UPI, when government becomes a part of it, I'm sure you guys are aware of BHS, the Bharat Health Stack. Some of the team members are same who provided the platform, the UPI platform for demonetization part. Pretty much all the leading VCs and all leading healthcare technology firms in India, 1MG Factor, they are part of that group. So you see a lot of money and brain powers behind that. And government has also legalized recently, I'm sure you are aware of, legalized teleconsultation. Earlier, there was no provision. So there are all the signs for us to start thinking. I don't know, I would love to get our panelists' thoughts from hospitals' point of view. Is I'm just hallucinating, or is it a reality, the digital consultation shift?
Yeah, thanks, Dr. Bhupin. I would ask one of the hospital panelists to take that question. Who would like to go for it? I'm just unmuting you all.
I will take up that.
Yeah, go ahead.
Yeah, see, when you look at the post-COVID, the scenario for, in case if you look at the government, as such today, the government has not identified the medical value travel as an industry. Although when you look at the industry today on a whole, it generates more than $5 million. When you look at an average spending per patient is more than $3,000. It is a very big industry. Today, the industry, now the government has identified because of the huge loss that they have meted out because of this medical value travel and the pandemic mixed together. So now they have, in fact, the organizations, the associations, a lot of people are there. A lot of more than 20,000 people have lost jobs during this pandemic, at least in healthcare. When you look at the support from the other people, Medical Value Travel Association, in fact, have reached the government. The only thing, the measure that we can do is to bail out through a kind of a sponsor or a fund from the government to recap or to revive the industry of medical value travel. That is the only measure that presently we are looking at. And the figure ranges from 250 to 300 crores. It's going to be a fact or not. Of course, the proposals are being submitted to the government. Let us see. Yeah.
Yeah, it's going to be an interesting thing. What the government take is going to be on that. On that note, we'll move on quickly to our next question. So the resumption of airline and the hospitality is on the cards. How to alleviate the fear of travel? Joshua, would you like to go first on that? Joshua?
Yeah. I'll see one thing about as we was looking at it, it's true. It's a lot of fear is there. Okay, there's a actually even why talk about the people? Even when, as Guru was as Yogendra was saying, like both of us were in Kenya when this whole thing came and we had to rush. We're just hoping that when we travel, at least we will not get infected. Okay, we had the fear for it. So one thing is when, of course, the government is also putting a lot of rules. I mean, right now, even for all the passengers, they have made it clear that there should be a 2 weeks quarantine and things like that. But one thing that we are looking at and thinking about is that first thing is be very clear about the patient's health status before they come, and then even after they come, we are right now preparing ourselves. Like once creates a quarantine packages. What are we going to do? How are we going to handle it? 2 weeks association with ties with hotels and guest houses. For 2 weeks, they're going to stay there, taking care of them and making sure that our interference is also there. And when it comes to the medical aspects, doing things like that is preparing preparing the patients before they come also. See, one thing is that their expenses is going to be a little higher than it was before, but we need to prepare them for it. For example, we already started having tie-ups with hotels and all, in which we have 2 weeks package for them, in which their stay, which is a discounted place, and additional, we also have a plan when to look at to check the vitals and to make sure that the patient is doing well, seeing whether the patient is infected or not, just going and checking, sending a paramedical staff to check, and if required, a doctor to visit, consultations, teleconsultations if required, is already been prepared to make sure that when we start it, okay, and the things will go, we'll be able to, at that time, we won't be wondering how to go ahead. We are all prepared with that. And also we make the patients, like right now, some of the patients who are ready to come, they're asking the same question: what will we do if we come? So we are preparing them. This is what is going to happen, and you have to be prepared for these 2 weeks. You have to be isolated. You will be in the quarantine, and then only your treatment is going to start. And for that, you need to be prepared with so much of funds and things like that. We are preparing them so that they will be confident to come over and go ahead.
Yeah, thanks, Joshua. That is something, a preparatory phase for travel, as you said, and people have to be properly communicated about the quarantine rules and stuff. And that's when we can successfully address a certain part of the fear and anxiety that which would be involved in the travel. For want of time, we will just move ahead with the other questions, and the other panelists can answer the next question. So this question is to Yogen and Guru. What are the countermeasures for VUCA for which would be affecting the MVT or in a positive way and stuff?
Yeah, thank you. See, VUCA, as you rightly said, it stands for volatility, uncertainty, complexity, and ambiguity. It is a combination of qualities. When you look at it, they characterize the nature of some difficult conditions and the situations. Now, when you look at the countermeasures, what are going to be the first thing is that the flexibility, which comes in the terms of telemedicine. As we earlier also discussed, the online consultations which has taken up, we are quite flexible. Although the technology was there, the countermeasures that we have to do right now is first is the telemedicine, the online consultation which has started. Payment portal has started. The second opinion has started. And also when you look at the speed in which the response to medical inquiries, because it is going to open up once after the vaccine is launched, COVID is going to open up. It is going to open up for the world. And the speed in which the medical inquiries are being responded within 24 hours, within less than 24 hours, any inquiries that we get to the hospital are being responded very fastly, very swiftly. Lastly, when you look at the VUCA post countermeasures, we are looking at collaborating with the local skills in other countries. Earlier, the skill was not used. Today, when you look at, we are looking at identifying the skills that are in other countries. Example, the hospitals will have their own information systems in the respective countries. The local manpower is being identified. We are trying to train them through whatever mode we have. Presently, we have got only online mode. Through this mode, we are trying to equip them, train them with product knowledge, send them into the field, getting us more of information, getting us more of online inquiries. Those are the things that we are trying to counter this VUCA. This is my view. Thank you.
Yeah, thanks. Yogen, you would like to add on to that?
Yeah, so basically what I feel is, what the most important thing is basically realization till the vaccination. So even so we'll have to wait till vaccination is introduced and it is readily available and people are vaccinated. Till the time, people will always have a fear in their mind to travel. So till the time, most important thing is realization that this is realization of the fact that this is how the life is going to be, and you have to take care of yourself. You have to be careful of yourself and make sure that you take all precautions. Secondly, with the confidence that wherever country they are traveling, the government should make an effort that the positive note should be sent out to everywhere, to everyone, saying that the systems and protocols and the process undertaken in India are pretty sound and effective. So all the doubts that people might have before traveling to India, so that can be counter, so that can be negated. So I guess from the government perspective, that is the most important factor, that a positive sign should be sent out to all the passengers, all the country, saying that we are ready for business. Right now, the signs that we are throwing out is I'm not kind of against the government. I think whatever government is doing, they're doing pretty okay. They're doing pretty fine, considering that these are the situation nobody would have predicted and nobody would have known. So considering that, government is doing pretty fine. But the thing is, they should be a little bit more active, proactive, in terms of sending signals saying that India is ready for business now. And when we say ready for business, we should not throw the cautions out of the wind, or out of the window. But yes, we should be very cautious. Simultaneously, we should give a signal that yes, we are ready for business. You are most welcome to come.
Raj, for some reason we can't hear you.
Yeah, I've been on mute and I've been speaking. Sorry about it. So thanks again for those interesting insights from Sputnik to Covaxin to Novavax to Moderna. We don't know what is going to come first to India, but we're all very hopeful. And over to you, Joshua. Would you like to take this question? For the patients in attendance, what happened to the stranded patients during the lockdown? And similarly, stranded team members, we do know that a lot of foreign information offices are set up. So what assistance was being provided for relocation from the other countries to here, and also for the patient and attendants who were stranded in India?
About the team, the standard team, one of them including me, whoever out were immediately asked to come back. Okay, I had a very long plan. Even when I met Yogi, I said, no, I'll be going next week. Yogi was leaving the next day itself. I said, no, I'm going to go only after 1 week. And we had a lot of plan and all. But immediately a call from the office say, Joshua, please come back. They sent us the ticket, and everybody was made to come back, and made to, even after coming back, were asked to be quarantined for 14 days before going ahead with whatever work. That's one thing that was done. And even when it comes to our information centers, the teams there who are the local people there, they were also informed and given instructions what to do. When it came to the patients who are here, that was one thing that was immediate action taken as soon as the management made us clear how to where would stand they are. immediately teams were formed. The marketing team, international operation teams, and the medical team, all of us were really teamed up. And because many of the patients were undergoing treatments, some of them even had got their approval to go with the transplants, liver transplant, bone marrow transplant, and liver transplant, kidney transplant, bone marrow transplant patients were there who had who were well prepared, who were to go ahead with the transplant also. So one thing is just to the patients were actually adopted over, usually because operation team usually takes care, just arrange for them to come, appointments fixed, and take care of them. That was usual way. But at this time, because they were really confused, they didn't know how to go ahead, what to do, their finance, how are they going to manage, and so many things. So one thing was that the patients were adopted. Every day, one of us were making sure we are calling them, talking to them, and who was possible was meeting them, and the treatment, being in touch with the medical team, making sure that the treatment, whatever needs to be done, because bone marrow transplantation patient needed regular consultation and review, and many times platelet transfusion also, and radiation therapy patient, you just can't stop the radiation, and then kidney transplant patient, the dialysis, so many things. Like the whole plan was made. Whichever end of Hyderabad the patients were, however far, we were making arrangements for them to be picked up and brought back here, and dropped back. Complete responsibility was taken, and so those patients were never left alone. Even when it comes to because their stay was being stretched. So when it comes to financial part of it also, they were worried, how are we going to spend? We need to raise more funds. Many of them were worried about it. So when it comes to the hospitals, guest houses, they were given discounts for the stay. Even the hotels and service apartments that we are connected to, requested them, they gave discounts just to help them, to manage them, and make sure that their needs are met. And even the reason why we are calling every day is because to making sure that asking their needs. It may be a small thing they need to buy, but they are afraid to go out. Yes, there's a lockdown time. They are allowed to go, but also some shops may be far away. The things that they need will not be available. So we are making sure to make sure that our driver goes, picks them up to the place where they need to go, brings them back, and every kind of need was taken care. So they never left alone. And till now, the patients were gone. Even when they're going back, all the help for the evacuation, because their embassies were, of course, involved and giving us what to do. But then paying that, arranging for the money, for paying for the tickets, all things were completely involved taken over by the teams. So that now all of them, when they went back there, they really messaged us that they were fine, and they were very grateful to what went on. So that way, the patients were really taken care and never left alone. That's one thing that the Yashoda Hospital it was done.
Thank you. Thanks, Joshua. Moving on, so teleconsultations. We have earlier talked about it, the growing impact of it. So Ms. Shanti, would you like to take it first, and then we'll have another panelist, Guru, also joined in.
Sure. So very quickly, again, teleconsultation is something that is a part of our future. This is something that we cannot avoid. I think moving forward, this has to be incorporated as part of the hospital strategy. This has to be incorporated as part of the doctors and the medical clinic strategy. Now, in what format and to what extent you want to do this, again, that needs, I think we need a separate regulation. We have a regulation for teleconsultation as of today, but I think we need to revise the government policy and regulation in the sense that, what about the second opinion? Because second opinion have their own boundaries and limitations. You will not be able to eat up to the initial doctor's area, right? So if a patient X is visiting Dr. Y, and then if he wants to get an opinion of Dr. B, then there needs to be some kind of a boundaries, and I think this needs to be properly crafted in a government policy and regulation. So this is again moving forward. There will need to be a lot of regulation and policy changes with regards to how patients see medical practitioners and how medical practitioner sees patient. That's number one. Number two, cross-border. Now today, if I want to talk to a doctor in India, my government cannot stop me, and the Indian government cannot stop me as well, because this is patients' rights, right? The doctor-patient relationship is actually internationally recognized. Patient rights is the same everywhere. It's not that I have these rights in Indonesia. When I go to India, my rights as a patient differs. It's the same everywhere. So it's an international standard. So you need to have this from both approach. And I think unless we work with the government to tell them that this is important for them to address, then the potential of medical practitioners to grow their wings. I think teleconsultation is not a threat to the medical practitioners. It's not a threat to the hospital. Actually, it's an avenue. It's an additional tool for them to grow. And I think this is what I'm working, and I'll be reaching out to some of you today after this this event to see how we can collaborate and cooperate, because there are a lot of potentials. Do not look at the limitations. Let's look at what potential lies ahead. And I think this is what I want to imprint on the minds of the panelists here and also the minds of the participants.
Thanks, Ms. Shanti. And Guru, can you go for it?
Yes. See, telemedicine is again, since your first question, I've been somewhere linking the telemedicine to my answer, if you see, notice. Because this is one of the most favorite subject of me, because if you see, this is one of the biggest revenue contributor. If you look at the revenue for a hospital, this can greatly contribute, one. Secondly, the patient's access to the doctors, is 24/7. They are available through online mode. On individual basis, today when you look at a patient, but as Shanti rightly said, the regulations, there is a big gap in the regulations, I would say. The government is not yet clear, has not laid any norms or rules for doing a telemedicine. It's a very big subject. In a nutshell, I would say it varies from country to country. Today, a Bangladesh patient cannot do a proper or an approved video consultation with an Indian doctor, because the rules of the Bangladesh do not allow them to consult an Indian doctor, and the Indian doctors do not have the rights to prescribe in their own letterheads to the patients. Now, what is the point? Is not it now. What you have done is only the 80% of the work. Telemedicine is there, technology is there, the doctors are available, patients are available, medicine is available, everything you can link. But the government has not yet given any approval for the patients and the hospitals to interact with each other in an official platform. Yes, few companies have popped up. So many companies like in India and overseas, they have popped up for doing this telemedicine platform through a software. But yes, we are not in a position to get into that and buy that and use that, because it may take some time. The government has to regulate. That is the only thing that needs to streamline. Rest, if you look at the positive aspects, it's the biggest revenue contributor. Patients do not have to wait. Waiting period, there is no waiting period in a telemedicine. You just have to log in. Some people have got a software, some hospitals have got an online platform through their website. They just have to log in, book their slot, pay some money, $10, $5, $2, whatever be it. They just have to pay, wait for the doctor to be met through the computer, what we are doing right now. That's what it is, the positive aspects. Only thing, it needs to be streamlined. That is my point of view. If of course, the various associations have, of course, approached the government for some kind of regulations, it might be done very soon. We'll wait for it. Thank you.
Yeah, thanks, Guru. And Joshua or Yogendra, would you like to go for the next question?
Organizational measures to restart MVT I think everything depends on the government right now when they will start the travel. So after that, only only thing is yes, as an organization, we all have to be prepared that as I mentioned before, things are not going to fall back to the same old days right from the day one. It will take some time, and as an organization, they will have to have a little bit of a patience, and they'll have to keep faith and trust on their team that they will bring back they will bounce back, they'll get the business bouncing back to the same old track. So a little bit of a patience from my kind of an advice from my side to the organization, and we'll just wait for the government to start the air travels, and then we'll see how it happens.
Yeah.
Yeah.
Just to add.
Thanks again, Joshua. Yeah.
Yeah. One thing is, of course, we'll have to wait for things to happen. But one thing that we can do when they open up is first to let people in the other countries be confident that a hospital is functional and we can handle, and we are handling well, and we can do well. So just make sure that we make them aware of what's happening, how the hospital is going on right now, because especially looking at the India's count, the number of positives and all that stuff, some people will have the fear. To let them know that precautions are being taken care in the hospital, so things will be fine, and making them confident about it, that will really help for them to look more positively towards coming over.
Yeah, so an open question to all the panelists before we close this panel. What is the future outlook of medical value travel? Where do you see it going? When is it going to be back to normalcy?
See, I would say that like all other segments, recovery and revival of medical value travel is going to be a very slow process, at least for some time. For a couple of months it might take. But I'm sure that the only one difference between the medical value travel and other industries is that the revival is going to be very, very quick. It's going to be very fast because there has been a big waiting period for all the patients. A lot of patients, one of his discussions, Mr. Joshua also said that a lot of patients have been waiting right now, and there is going to be a big influx of a lot of inbound medical tourism, which is going to start very soon once after the international flights open up. Of course, some of the countries, the visas have already opened up. In countries like Bangladesh and Nigeria, they have already declared that the Indian embassies are open for visas. They've already started collecting visas. They are keeping it for visas being issued. And only thing is that they are waiting for the international travel to start. We are sure that it might start in a couple of months, but it is going to be very quick, and influx is going to be very good. Thank you.
Thanks, Guru. Joshua, you want to go ahead?
Yeah, it's true. As what Guru was saying, that may take a couple of months, but things are even. We were lucky enough that a couple of days back, one patient from Uzbekistan could manage and come. So it actually, luckily, right now, when it comes to the airlines have opened up, and once visas issued only right now with only real emergency cases requirement, and especially with only one attendant, now a lot of protocols being used, but thing will go on. We may have to wait for a couple of months, but once it starts coming, yeah, we will have a lot come in. And but that actually right now the situation is that the way India is handling death rate and things like that is actually many people, they are even, whenever people are talking to me, I even saying, oh, not bad, you guys are good. Okay, so our impression about us also is improving. It's actually a way of advertising ourselves, the way things are being handled. So we're looking forward for it.
Yeah, Yogen, you would like to go for it?
Yeah, I'm just keeping my fingers crossed, and I hope what my dear friends Joshua and Guru said actually come true, and we all are ready for for business to revive, to restart. And I also feel that, there are a lot of patients who are actually in need of travel, and they need a treatment, and they need to travel as soon as possible. They otherwise will lose their life, COVID, no COVID. So there are a large number of patients who are actually looking forward to travel to India. But I still feel that, it will take some time. Going back to what the pre-COVID era, it will take at least a year. Even if the flight starts tomorrow, it will still take some time. Because there will be a lot of although I'm aware of the fact that Minister of External Affairs have been submitted SOPs on handling international passengers, but all these things, bureaucratic issues take some time to get resolved. It will take some time, and over a period of time, and but the deal breaker would be, how the government has performed in containing the COVID or pandemic in the country. That will also be a deciding factor for a person to decide whether to come to India or go to Singapore or go to some other country.
Yeah, thanks again. And Ms. Shanti, you would want to add on to that as a closing comment for the medical value travel section, the future outlook?
And we need to really work out a new format within the private sector, and also the government work together to form a new format where patients would be the first priority. Now what we see happening is that there is a lot of resistance, either from the medical practitioner side or even from the government side, and as a result of that, patient is suffering. I think what we need to do, even post-COVID, let's put patient first, whether in India or in another part of the country, cross-border, because the world needs to be opened up again, and let's put patient first, and let's work on creating such a government regulation that would support patients' rights to get healthcare access. I think that's my only summarization to this first panel.
Hello.
Thank you. Can you hear me? Can you hear me?
Yeah, I can, yeah.
Yeah. So did you hear what I was saying, or was it not clear?
The last bit was not.
Okay, I think what we need to do is we need to work closely with private sector, and the government needs to work closely to make sure post-COVID patients' priority is kept on top rather than other business needs and all that, because patients have also suffered tremendously during this lockdown period time, and we need to quickly revitalize that.
Yeah, thank you, Ms. Shanti. For want of time, we will keep your presentation last.